Assalamu alaikum and very good afternoon. Every October, you likely see a wealth of information about breast cancer, and that's a good thing. Awareness surrounds breast cancer is incredibly important as early detection, often through screening, can catch the disease when it is most treatable. I would like to welcome you all to the special breast cancer awareness webinar with Prime Health, and thank you for joining us today. I'm Dr. Asia, Assistant Medical Director and General Practitioner at Prime Health. We are live on our official social media platforms, including YouTube, Facebook, and LinkedIn. Our intention at Prime Health is to educate people, create awareness through various platforms, as we believe correct knowledge is the first step towards prevention. Today's webinar focuses on all of you to know the risk factors, knowing the warning signs, can mammogram actually save lives, treatment options, the truth about can breast cancer affect men too. Breast cancer awareness need a multidisciplinary team approach. To know everything in detail and to answer all your questions, I would like to welcome our first speaker to this webinar today. Dr. Jamini Mahajan, welcome to the program, Doctor.
Bundle of thanks, Dr. Asia.
Dr. Jamini Mahajan, a gold medal winner in obstetrics and gynecology from Sion Hospital, Mumbai. She has joined us from Prime Medical Center, Al Nahda, Sharjah. She is a member of Royal College of Obstetricians and Gynecologists in London, as well as the National Academy of Medical Science in New Delhi. As an American board certified lactation consultant, she pursues a special interest in lactation. Thank you, Doctor, for joining us today. I would like to add my second speaker on this webinar today, Dr. Virushka. Dr. Virushka Mukesh has joined us from Prime Hospital. She's our specialist surgeon with extensive experience in surgical oncology and a particular interest in breast oncosurgery. She has a vast 13 to 14 years experience in her field and is a member of Royal College of Surgeons of Edinburgh. In addition to her many publications, she is also an editor of the Examination Preparation Manual for Surgery for Undergraduates. She is an active participant in the wellness and health of women. Welcome, Dr. Virushka. Dr. Virushka, you are on mute if you're saying something.
Thank you so much. Thanks.
Thank you. Now I would like to welcome my third speaker on this webinar today, Dr. Arun Karanwal. He is a specialist medical oncologist with more than 10 years experience treating adults and children. He has joined us as well from Prime Hospital. He manages all kinds of oncology patients, including tumors, blood cancers, chemotherapy administration, palliative care, as well as benign hematology. As a principal investigator, he has conducted clinical trials with esteemed organizations such as IMA, European Association for Neuro-Oncology, ESMO, EMA, and the list goes on. Welcome to the program, Doctor.
Thank you. Thank you.
So let us begin with our series of questions. In the meantime, I would like all our viewers who have joined us today, if they have any questions, please write in the comment box so that the doctors can answer it accordingly. Topic is breast cancer, and topic is very vast. So, Dr. Jamini, I will start with the basic thing because for a woman, gynecologist is the most important point of contact since her childhood till she is alive. So, what is the important to know about breast cancer for all?
There are so many things that we should be aware of the breast cancer. First of all, it's the most commonest female cancer that we know about. The other thing is that the incidence of breast cancer has been increasing over a period of time. We are seeing more younger women getting breast cancer. We've been seeing patients getting cancer even at the age of 20, starting from the age of 20 years. So that is one of the things. But the good thing is, it was because of the incredible treatment options that we have nowadays. It has moved from being an hopeless diagnosis, which was, before oh, it was cancer. So you thought, okay, that's the end of the life. But now it's no more a hopeless diagnosis, and we have got very good care. So the life expectancy has increased. Patient has a better quality of life. Other thing is like people think, okay, the cancer only runs in the family. But the fact is that only 20% of the cancers do run in the family. That is due to abnormal gene defects. But 80% of the women do get breast cancer who do not have any risk factor. So it's very important that patients needs to screen themselves. Screening is when we pick up the disease before there are any signs and symptoms. The earlier we catch the breast cancer, the better lives we save. So this is in a gist very important, and that's why we are having this breast cancer awareness month, where we are all coming up with the information and people are more educated and empowered to take decisions for themselves.
Thank you, Doctor. Quite precise it was. So, as far as the OPDs are concerned, do you really see women encouraged to go to the gynecologist and asking themselves to go for a breast physical checkup?
Actually, because of the awareness programs that have been ongoing, and because of these months, now I see more women coming to us, and they are concerned, and they are a little bit better educated. They know about things, and yes, so nowadays patients are coming and seeking help when required.
Do you still feel it difficult for some women to get themselves checked for breast cancer physically, at least with the gynecologist?
Sometimes yes, because patients are not very comfortable when it comes to their intimate areas. They are not comfortable about talking about the intimate things. So that kind of hesitancy still exists in the society, and women need to be more empowered. They should feel very comfortable around their breast. They should know how their breasts look like, how their breasts feel like. So that would be something which should happen more frequently.
So you mean to say that it has to be more common topic to be talked about, and thanks to all these awareness programs, which brings at least the woman at least in a year. We all know cancer doesn't happen overnight. It takes a stage to come to a certain level, and sooner we get it checked, sooner we can have a better treatment. So these kind of awareness programs do have an impact. With this, I would like to ask Dr. Arun. Doctor, very important, and I would like to bring this question first in this, not at the last. Do men can also have breast cancer?
Okay, in general, breast cancer is related to the woman, as we are hearing from all the scientific literature. However, men can also develop breast cancer. It is not so much common in the men. For the female breast cancer, as we know, it is the commonest type of cancer in the females or the ladies. However, for the males, it is like a very rare type of scenario or very rare type of disease we expect. Uh, if we see the percentage of total breast cancer, it will be less than 1% of breast cancer which is detected in the males, particularly. Again, it is generally considered to be a disease of elderly. So, after 60 years of age, there is a more risk of developing breast cancer in the males. There are certain risk factors which we can understand, which we can identify, which can increase the chance of getting this tumor in the males. Like they are generally related to past history of exposure to radiation therapy or radiotherapy in higher doses. It can be because of some hormone related disorders like some genetic chromosome disorders like Klinefelter syndrome, where there is excessive estrogen production in the body. It can be because of the testicular disorders where the testosterone production is very less, and the balance between the estrogen and testosterone is very high. So all those scenarios can increase the risk of breast cancer. One more important risk factor is the family history, and particularly some of the genes like if we can talk, the most common known genetic risk is the BRCA mutation. So the family members having a BRCA mutation, which is passing on from the family members, uh, can have a high chance of getting breast cancer also in the males. So, although it is not very common, but it is possible to have a breast cancer in male.
Doctor, do you see anything wherein we can increase the awareness, not only pink October for women, but also at least pink and blue for men and women to get themselves checked for breast cancer? So do you see that in future we can also create the awareness for men at several platforms, and people actually at high risk needs to know? So what do you think the future has?
Yeah, so in general, the awareness for such a disease like cancer has to be a continuous process. It should not be like we should not expect that we'll do just awareness in one day of the year or 1 month of the year, and it should be focused on the general health well-being. So both males and females has to be aware of their organs and the body, and if they feel any difference in that area, any specific symptoms or any persistent change in any part of the body, they should report to their family physician or the nearby doctor, so that they can understand whether it is related to some serious disease like cancer. So for the males also, it is important to be aware that breast cancer is possible, although not very common. But if they see any changes in the breast area or the nipple area, like for example, any sort of persistent lump feeling in that area, uh, presence of change in the skin texture, or presence of bleeding from the nipple area, that those can be the signs or symptoms of early breast cancer. So they should report to the nearby physician, so that we can identify the disease on the early stages.
Thank you, Dr. Arun. So here it's very important for all the viewers or people who will be listening to us this webinar later on, that the best thing is always to screen. So we should not get actually into diseases and then treat the disease. So the best practice is to screen, to talk to your doctor. We all have one particular doctor, at least in our life, at some point of time. We can always discuss, and we should be away from such things. So I will now ask Dr. Gemini. So when should anyone begin actually a checkup for breast screening?
Yeah. So, as we rightly said, that nowadays we are seeing the cancers also occurring in the younger age group. So, it's very important that after the age of 20 years, all women should do a breast self examination. They should be comfortable around their breast. They should understand how their breast looks like, how their breast feels like. Every month, they should do their breast checkup, and they should palpate the breast properly, and they should check all the areas well and see how normal their breast tissue feels. So if any change they feel that has happened over a period of month, they can go and report to the caring physician, and then the steps can be taken to diagnose early and treat early. Secondly, we know that breast cancer, the incidence increases as we age. So, aging is something we cannot control, but we can take steps where we can prevent us from getting into serious illness. So, we recommend that after the age of 40 years, annual mammogram should be done. So, mammograms are nothing but x rays of the breast. So, yearly one mammogram is recommended for all the women above the age of 40. Again, they can do it up to the age of 55, 54 to 55. After 55, depending how their previous mammogram reports are there, they can do it annually or they can do it every 2 yearly. One more thing is there, some women have very dense breast tissue. So, along with the mammogram, an ultrasound can be added to that. The other thing is, as Dr. Arun had pointed, that there are some familial cancers, or there are patients who carry mutations like the BRCA1, BRCA2 mutation. So, in those patients, the screening for the breast cancer can began early, and they can also combine their mammogram with the MRI. So they can talk to their physicians what is the best tailored approach for them. So definitely, in general, at 20, breast self-examination to begin, and at 40, in general population, annual mammogram should be done.
Dr. Asia, your voice is not there.
Yeah, sorry. Thank you, Dr. Arun, for letting me know this. I was on mute. So, Dr. Gemini, I just want to know that sometimes a woman don't reach to the doctors and would like to self-investigate. And since we are creating a lot of awareness about ultrasounds or mammographs, so what should she begin first with? At least if she don't want to consult a doctor and directly wants to know about the well-being of the breast.
So one thing is, she can do herself is the self-examination, and mammogram is the very basic thing to be done. So after the age of 40, the woman can do it, but it's always better to consult the physician and then go for the further testing. That is the thing, because they are the one who are going to guide you and they are going to advise you. So it's the choice of the woman at the end of the day, what she wants to opt. But when she talks to a physician, she knows what are the choices available. Very important to consult the physician first and then just go for the test.
Doctor, we have a question from Miss Bachari. It's on the screen. Kindly advise the symptom of breast cancer. So if you can just put some light on this.
Yeah. Symptoms of breast cancers, when we put it, basically, it begins like a painless lump most of the time. So patients might feel some kind of lump or a growth in the breast, which is like a little bit hard in consistency. They might feel any dimpling in the skin, or they might feel any discharge coming from the nipple. Sometimes this can be a painless bloody discharge coming from the nipple. There can be like a change in the skin type of the breast tissue, which can look like orange. We call it the pudgy orange appearance. And we have the extension of the breast tissue in the armpit as well. So in the armpit, they might find a growth there, some kind of swelling, some kind of bulge, some kind of redness. So those are the things by which the patients might come to know, these are the things that we are looking into breast cancer.
Thank you, doctor. Thank you for that. Dr. Arun, we have something called inflammatory breast diseases. And generally, when we say inflammation, that means some kind of infection. Is this really infection or a serious concern?
So, in general, the inflammation is mainly or most commonly caused by any source of infection. However, inflammation is it is a condition in which lots of other diseases can also be underlying cause. So, one of the cause can be tumor itself, and any tumor in any part of the body can cause inflammation. Basically, inflammation is your reaction of your body or immune system to control the situation of the underlying reason. So tumors also start lots of inflammation in any part of the body, and that can happen in the breast cancer also. Although it is not again very common situation for us to see an inflammatory breast cancer, but when it is there, it is very important to diagnose early because there is a high chance of missing underlying tumor. In that situation, the breast will be completely, the skin will be completely changed. It will be hard, tender. There will be redness signs, and lots of people will consider it to be an infection rather than a malignancy. And if you miss the tumor in that phase, there's a high chance that a tumor will continue to spread to other areas, and ultimately we'll lose the opportunity to cure it. So it is important to diagnose inflammatory breast cancer on the earliest basis. The importance is to go to a right physician to have early diagnosis. Whenever we see such kind of symptom, we have to meet immediately the breast surgeon who can do the checkup and do a proper biopsy to confirm the tumor. And in most of the scenarios, the inflammatory breast cancer require treatment in a slightly different way. As we are aware, most of the ladies will be treated with the surgery in the breast cancer, followed by some other form of treatment if required. But in inflammatory breast cancer, we always start with the chemotherapy or a medicine to control the tumor first, and then in the later part of the treatment, surgery will be added to complete the treatment part. So basically, the treatment approach is also different, and that's why we need to diagnose it early and refer to the concerned team of doctors.
Thank you, doctor. So, I would like to tell my viewers that our breast surgeon, Dr. Virushka, is on urgent call for one patient. She'll be joining us shortly. But since we are talking about, signs and symptoms of the breast cancer, examination of the breast cancer, then definitely what is the role of surgeon? I would like her to come back and speak on that topic. But the other topic is, the treatment part. So once the lump or cancer is diagnosed, definitely there is a major role of the oncologist or oncosurgeon here. So, Dr. Arun, what are the different treatment options when we diagnosed that it is now the cancer of the lump? So, what are the important factors for patients to know? How important it is? What is important for the family to know as well?
So any kind of diagnosis like a cancer disease is a sort of very stressful situation, and most of the patients or the families will go into a panic mode, and they will try to search like and go for immediate type of treatment options. However, it is important to remember now that we have lots of research and advances in the treatment, not only for the breast cancer but for all the almost all the other tumors, and proper planning of treatment is very important. So after a diagnosis of such disease, they should meet a concerned oncologist who can guide them about a proper evaluation and a proper treatment plans. Many time after biopsy, we still recommend lots of other tests, like particularly to complete a staging of the tumor. Staging is basically to identify whether the tumor is limited to one area of body or it is already spreading to other parts of body. So staging is very important to have a clear treatment plan. So those kind of tests, like including the CT scans or the PET, are recommended. Many times we do more analysis on the biopsy sample. So lots of tests may still be required after the first report of biopsy. And based on those extra information and the proper staging of the patient and understanding the fitness of the patient, their age factors, their other comorbidities, then the oncologist can guide them for the proper treatment sequences. And in current times, most of the tumors require multimodality treatment, including the breast cancer. And at some point of time, different type of treatment will be added to the treatment plan. And if we speak mainly for the breast cancer, then in general, three major treatment options are used for this treatment. Uh, Starting with the surgery, which is to remove the tumor in one go, along with options of medicines, which can be chemotherapy, which can be hormone therapy, or some new forms of therapy like anti-HER2 targeted therapy, immunotherapy options, and one more local treatment which is called radiotherapy. So it is a combination of these three major types of treatment. Different stages may require different role of these ops, and the sequence is also different. Like in slightly advanced stage of the disease, which is where the tumor is slightly big in size, or it has already starting to grow inside the axilla, or the lymph nodes are there in the axilla, we most of the commonly start with the chemotherapy to debulk the disease or reduce the size of the tumor, and after few months surgery, and then the remaining part of chemotherapy and sometimes radiotherapy. And if it is very early, small size of the tumor, which is not already spread to the axilla, then most of the time the surgeon will take care initially. They will remove the tumor, either just the tumor or the full breast along with the axillary lymph nodes. And as per the report, we decide whether the patient will require additional form of treatment. So the sequence and the options of treatment can change from patient to patient and as per their tumor behavior. There are lots of other information in the tumor biopsy sample, like what is the status of the hormone receptor, what is the status of the HER2 receptor. Based on all those parameters, we decide like how much treatment is needed and what is the best way to cure the this kind of tumor.
Thank you, Dr. Arun. Quickly, a question from Ms. Karanwal. Does underarm laser hair removal contribute to breast cancer? Do we have any such research? Maybe my other speakers can put some light on this question.
So scientifically right now there is no such proven thing that laser may increase the chance of breast cancer or any other cancer. However, there are certain medicines like topical medicines which are used in certain skin disorders which can increase the risk of skin cancer, particularly in that particular topical area. So laser are still considered safe.
Thank you, Doctor. We have Dr. Virushka with us. Dr. Virushka, we spoke about signs and symptoms of breast cancer. We also spoke the importance of breast cancer. We also spoke about the oncology part of it. I would like to know, patient has done with the ultrasound breast. One scenario, patient has done mammogram, other scenario. So ultrasound, definitely we could find out a small lump. What is the next step for patients to do?
Okay, so thank you for having me. So first is the age of the patient. It would be important to know the age, the family history of the patient, any risk factors as we have discussed, and then decide which patient would need what. So if in ultrasound there was a lump found, and if she was above 40, then of course I would like to do a mammogram to rule out any calcifications. So a mammogram is like an X-ray of the breast, which helps us to find out calcifications on the breast. There's something called the good calcifications, and there's something called the bad or the cancerous calcifications, or there's something called the precancerous calcifications. So then we would decide to go ahead with the mammogram. If a patient has done a mammogram, I will always advise the patient to do an ultrasound, irrespective of the age of the patient, because sometimes very small lumps or very small cysts, that is fluid fill lumps, or solid lumps, cannot be picked up on a mammogram. So sometimes, even in high risk individuals, I sometimes ask them to do an MRI. So they have a very strong family history of the first, second, and third degree relatives. We have to couple it with multiple of investigations itself. And last but not the least, irrespective of the size of the lump, the shape and the character of that lump is very important. So if I find that the character of that lump or the shape of that lump looks suspicious to me, I would always consider to do a biopsy. Now in biopsy also we have many different techniques that we have. We have it with either when we take a small piece of it, which is called a core biopsy, or we do a needle biopsy. If it's difficult for us to reach that area, or it is a fluid lump, we do a needle sampling. If it is something like in the duct, then of course a needle sample would be required, or removal of that duct to find out if it had a lump which is precancerous or cancerous. And the last is to remove that whole lump. Yeah. So there are different scenarios that we would see the patient as per the age, the genetic makeup of the patient, if we knew, the family history, the risk factors of the patient, their personal history, and then we would decide where she would fall and which investigations will be done.
Absolutely, doctor. I'll agree with you. But the current scenario is that a lot of people opt for self checkup and they do ultrasound and mammogram. There are lumps found as well, but they consult some doctors over the phone or they consult their relatives and they don't reach to the direct option. And I have seen personally also. I have witnessed some of the cases where it was supposed to be the woman is young in 20s and the lump was found and she was asked to come back after 6 months. By that time it was not a benign thing. It was already a malignant. So how we can reduce such chances? Do you also have witnessed such kind of things in your practice?
Yes, of course, Dr. Asya. We see a lot of these patients where they go for second, third opinions, and they have the right to do so. But the sad thing is, the wrong information can be given to a patient. And if we are more aggressive in breast, please note every woman should be, or even a male if he has a lump, should be more aggressive for breast lumps. My youngest patient with Dr. Arun we are treating is 23-year-old with breast cancer with no family history, no genetic makeup, no risk factors. So irrespective, we are getting 95% of the population with everything normal. So any breast lump should be biopsied unless proven otherwise, it should be considered as suspicious. Irrespective of the scoring system, we have a scoring system which is called the Barrett scoring, which is done by the radiologists on ultrasound and mammograms and MRIs. But without looking at the lump, the feel of the lump, all these should be considered before giving treatment options to the patient. Imaging, I always say, is a movie map, which is never 100% correct. It's a clinical picture, the techniques and the age, and then decide on treatment plan. So we have lost a lot of patients not doing biopsies at the time when required, and they come after a year and a half that it has turned to become malignant. So the sad thing is, we do a little bit more preventive breast surgeries is better than to find out that this lump has finally changed. Duration doesn't matter of the lump. More dangerous is that lump has been kept for very long. Size doesn't matter of the lump. My very simple example is if you go grocery shopping, you buy an apple. You buy an apple not only as for the size, you look at the shape and the character. You don't wait for the whole apple to turn bad, then throw it out. If it started getting spoiled from the inside, you don't notice it and you don't see it on the outside. Doesn't mean it's not bad. So every lump in the breast should be biopsies unless you prove it otherwise. Thank you.
Thank you, Doctor. I believe breast cancer is a kind of topic which really needs more attention, more awareness in a very logical and corrected way. Dr. Gemini, again, because women always reach to the gynecologist, and you are an American board certified lactation consultant. Question on the screen is how can we lower chances of breast cancer? All the points, at least people to know, and most importantly, I would really like to know, is it really true that lactation, can feeding your babies can really reduce the chances of breast cancer?
uh, yes, definitely lactation and breastfeeding lowers the chances of breast cancer as well as chances of getting ovarian cancer. So it's very, very important that it's a blessing for the babies also that they receive the mother's milk, and it is a dual benefit. It's the benefit for the baby also, and it's the benefit for the mother also, because it reduces, definitely evidence says that it reduces the risk of getting breast cancer. So very important that mothers should be encouraged more to breastfeed their baby rather than just going for the formula feed. If the situation is otherwise, then it's a different scenario, but definitely breastfeeding is recommended. And the other thing, how can we lower the chance of getting breast cancer? So I would just like to put in, there are certain things that are which are under our control, which can help us reduce the chance of getting breast cancer. But there are certain things we cannot control. We cannot control our genetic makeup. We cannot control the family in which we are born. We cannot control the aging process. So all these factors are the non-modifiable factors, and this is something can because of these factors some people can get breast cancer, but overall whatever things we can do to improve our general health will also reduce our risk for getting breast cancer. So even having a healthy lifestyle, doing daily exercises, even a 10 minutes exercise a day has shown to prevent the risk of getting cancers. So it's very, very important for us to stick to a healthy lifestyle. Quitting smoking again shows a very positive impact, and people who are non-smokers have less risk of getting breast cancer. The other thing is the alcohol intake. So even if alcohol intake can reduce like less than 3 glasses in a week, that is one more thing which can reduce the chance of getting breast cancer. Vegetarian diet and reducing the intake of meat also has shown to have a preventative effect.
Thank you, Doctor. Dr. Arun, I just want to know what is the main difference between chemotherapy and radiotherapy, just for our
Uh,
people to know.
Before going to this question, I will just highlight or just add some more information on the previous question, that whether the genetic related risk factor can be modified or not. Now there are certain new like research on that aspect also. Like particularly if the family member is detected to have a BRCA mutation, there are options of doing some prophylactic or preventive surgeries, like particularly to remove the breast tissue in the early age, and which can be like almost 100% preventive measure to like remove the risk of breast cancer in that particular person. So that is now new guidelines that any healthy family member having a BRCA mutation can think for this kind of preventive surgeries. That also holds true for the ovarian cancer. The BRCA mutation can increase the chance of multiple cancer, including the breast and the ovaries. And based on the last 10, 20 years of research, uh, uh, it is proven that if you remove the ovaries or if you remove the breast before the development of cancer, the risk of cancer will be almost 0% in such person. That is one of the new form of prevention we can tell to our patient. And coming to the second question, that what is the difference between chemo and chemotherapy and the radiotherapy? So both are considered to be anti-cancer treatment. Basically, both works in a slightly different way. Radiotherapy is like a local treatment. It focuses on one part of the body or one part of the disease. It can be used for different tumors in different stages of the tumor. Radiotherapy is basically giving high doses of X-rays to certain tumor cells to kill them and try to control them as much as possible. It is generally used in the breast cancer in certain scenarios, like when the tumor is in between stage 3 or 2 or 3. And if it is already spread to the lymph nodes in the axilla, or if the patient is trying to preserve the breast tissue by doing a lumpectomy only, then also it is needed to control the or cure the cancer. It can also be used in other stages of breast cancer, particularly when the tumor is already spread to certain organs, like in the bones. And if the bone spread is causing lots of pain, and if the bone is very weak in that area, then sometimes we give radiotherapy to control the tumor in that particular site. So it is a local treatment. It can be considered similar to a surgical treatment where we just try to remove one part of the tumor. In opposite to that, the chemotherapy or medicines used against the tumors are systemic treatment. They work in almost all the parts of the body. And again, in the breast cancer, the chemotherapy is added for different types of tumor or different phases of tumor treatment. Most of the breast cancer patients will require chemotherapy. However, again, there are lots of factors to decide that part, including the stage of the cancer, the receptor status like the ER/PR and HER2 status. There are certain new type of molecular testing like oncotype DX, in which for very early stage of the hormone receptor positive cancer, we try to analyze further whether the chemotherapy will really be helpful for patient. In certain patients, if the tumor risk is very low in this kind of test, we avoid the chemotherapy and we just continue hormone therapy. So there are lots of factors which help to decide like how much the chemotherapy will help a patient. So in early stages, it is used to cure the cancer along with the surgery and radiotherapy. But in the advanced stages or the metastatic stages, chemotherapy becomes a part or a treatment to control the situation. It tries to reduce the size of the tumor or reduce the symptoms related to metastatic tumor. And again, chemotherapy is not one type of medicine. Now we have almost 200, 300 type of different medicines which are coming under the group of chemotherapy. And it includes new form of medicines also like targeted therapy or immunotherapy, which is the latest one.
Thank you, doctor. I would like to begin because breast cancer or any kind of cancer is always a multidisciplinary approach. So I'll have a quick questions with all three of you about the case scenario. So Dr. Jemini, I'll just start with you. A woman is coming to you for regular checkup, or she has opted for ultrasound, breast, or mammogram, and you could find out there is a lump which is not suggestive of any benign or malignant, non-cancerous or cancerous. What will you do as your next step?
If it's an inconclusive report, you mean to say? Yeah. So
Yeah.
if it's an inconclusive report, I would obviously refer her to a person who is better at judging those lumps. So, like Dr. Virushka is the one who is a general surgeon who is seeing these cases day in and day out. So, it would be better to send her to a higher referrer because we are working as it's a teamwork. So, we want to give the best treatment to the patient. So, where I feel I am not able to justify this, where my knowledge is very limited, I would always take the opinion of a specialist who is seeing these cases on a day-to-day basis. So it's very important that we understand our own limitation and we refer the patient at the correct time so that the correct treatment approach is given to the patient.
Thank you very much, doctor, for that answer. At Prime, we definitely believe in personalized care personally. Now, the question I'll move to Dr. Virushka. The patient is coming to you with the ultrasound report or the mammogram report suggestive of lump. What will you do next?
Yeah, okay. So as soon as I see the lump, I look at the size, the shape, and the character of the lump. Then I decide whether she would need a mammo with or without an MRI, knowing her history and her genetic and her family background. Then, of course, I would always recommend, I would not stop there. I would do a biopsy, either a small needle biopsy or a proper tissue biopsy. Yeah. And then once we have that report, then we decide, is she suspicious for a malignancy? Is it an inadequate sample? Or is it something that we say it is benign? Then, even after we get the report benign, again, I go back to all the imaging and the patient's age, character, and history. And then we check, okay, is she high risk or she is okay? Or is she still in the gray zone? I will go ahead and remove the entire lump. That's about it.
Okay, so if you find that okay, it's a small lump, non-reactive, and the age is also low, and family is not cooperative, what will you advise to them?
So I would advise, of course, my recommendation would still be for a biopsy. If they're still that they don't want to do a biopsy, we give them the options, even though it's not a recommended option. But then it's say, okay, we can keep on follow-ups. But that's of course on the risk of the patient, as long as they know that it's risky to keep any breast lump. Although 60% of women have benign breast diseases, that means they are not cancerous. But of course, then follow-ups are very important. Self breast examination every month, one monthly. I would teach the patient and the relatives. I would also explain to her to come for what are the warning signs, and also do regular follow-ups even if there are no signs or symptoms.
So, Dr. Verushka, when you say most important signs and symptoms, we definitely have a long list. What are the important signs and symptoms? What family should be taken care, especially if it's a daughter and mother wants to make sure that these things are looked after.
So the most important symptom is that it doesn't present with any sign or symptom. The next is a painless lump or no pain in any lump or in the breast is also a symptom. Um, Lumps in the armpit, very important, which are missed. Recently, Dr. Arun and me are treating a patient, sadly so, with presented with a lump in the armpit, which was, of course, lymph node spread to the armpit. And when we examined, we found a large lump in the breast itself. So she was worked backwards. Then nipple discharge, not the liquid being just a normal transparent or yellowish, but more blood tinged or brownish. Any discharge should still be evaluated. Then, of course, skin changes, where the skin starts changing to become more thick, to become either red or inflamed, which is one type of cancer called inflammatory breast carcinoma, which is very aggressive. It's like a pimple in the breast, which is swollen, red, and inflamed. In a very bad way, it's been treated with antibiotics, and delay in treatment starts because the patient doesn't respond, and then for 1 month keeps it like that, going to different doctors. So that's a very important sign. uh, the breast nipple changes, it becomes retracted or inverted. So these are some of the very gross signs. That means it's a little late but still should come for checkups.
Absolutely, doctor. Do we really want to recommend something on the breast discharges from the nipple?
Yeah. So breast discharge can be first normal, right? Especially we see it in younger women, also unmarried, because of the hormonal changes that are happening. So a normal yellowish or transparent discharge is normally fine, but should be evaluated by the surgeon doing a cytology, where we do just an imprint marking of the fluid for a cell study. We do an ultrasound to couple with it, with or without an MRI, with or without MRI. Then there's something called a greenish discharge, where there's something called the ducts. In the breast, we have three types of tissues: the gland, the duct, and the fat, in a broad term. So any of these can form lumps or bumps and cause issues. So if it is a duct tissue, normally they have nipple discharge. So greenish, that means the duct is a little swollen, which can also be a normal, if there's no tumor, it can be a normal discharge, a normal benign change. There is a milk discharge, which can happen to patients not only who are breastfeeding, but even later in life, or if they have their prolactin, or what they call the milk secreting hormone, which is high, which can be evaluated further with an endocrinologist and also with the surgeon, and then checked and ruled out. And then you have the dangerous discharges, which is brownish, reddish, blood tinged, and yellowish if there's pus. So if there's an infection inside the breast, can also have what they call the mastitis or the breast abscess. So then we would treat.
Absolutely, absolutely. For all our viewers to know any kind of sign, please visit the doctor. Do not Google. Do not misguide yourself, because early treatment, early screening is the best way out for all these things. So I'll just proceed with Dr. Arun. So, doctor, same patient now diagnosed with breast cancer. So I'll give you two case scenarios where the same patient is in 20s, and we find a certain stage of breast cancer, and the same woman is in her 50s. Will there be a difference in the treatment?
Generally speaking, not much difference as per the age of the patient. The most important factors which decide the treatment, as I previously told, will be stage of the cancer, like whether it is limited to the breast area or whether it started to spread in the axilla or in other parts of the body. Factors like the ERPR status, HER2 new status are also important. Sometimes genetic mutations, if we can identify at the time of diagnosis, can also impact the treatment plan. So, particularly in the young age of diagnosis, we always advise the patient to go for a BRCA mutation to identify whether the tumor is linked to the this high risk DNA changes, and whether we can modify our treatment plan to give even a further improvement in the cure. So basically, the age will not become much important to decide the treatment plan unless the patient is very elderly, like more than 70, 75 years of age, where we have to modify our treatment options to maintain the less risk of side effects or the complications related to treatment. So otherwise, all the patients will be treated almost in the same way, depending on their particular tumor and its behavior and the stage of the tumor.
So, doctor, if the stage is 1 and 2, what will you generally opt for?
So again, in the stage 1 and 2, many times we rely on the ER, and HER2 status to say that whether we can start with the surgical treatment or whether we need some form of treatment before surgery. So particularly in the cases like where the receptors are negative, which is called triple negative breast cancer, where all ER means all three receptors ER, and HER2 will be negative in the tumor sample. This is the type of tumor which is very aggressive and has very high chance of recurrence. And in this particular group of patients, we always try to think whether we start with the chemotherapy first to reduce the size of tumor and then surgery. So any patient having a lump of more than 2 centimeter but triple negative breast cancer, even though the tumor is just 2.5 centimeter, will require a chemotherapy to be started first rather than surgery. So that is the latest research and the guidelines. This can help more number of patients to achieve a cure kind of state in the difficult tumor.
Thank you, doctor. As we proceed towards the end of the session, I'll just have a quick question with Dr. Jiminy. Um, what is in your practice of gynecology and obstetrics, do you really have do you remember any of the case which could have been advised or which has given which through which you have learned something and would like all women to know regarding the breast cancer or overall well-being of the women?
Um, yeah, so basically, when from so many cases of breast cancer that we see is it's very important to seek help early rather than seeking help late. So we have seen patients who have come early with a very small, very tiny lump, and they were doing breast self-examination so they could pick it up. They were investigated further. There was MRI done and there was biopsy done, and it came out to be cancer. They could go for the conservative surgery. So, Dr. Virushka, with if patients are coming early, the surgeries won't need to be very aggressive. The breast also can be saved in such patients. And if the symptoms are ignored over a long period of time, patients are not taking things seriously or are not aware. That is also one more thing. Women's health and issue is something like, they know they have this, but the family things take over. So I have to take care of my children's exam. I have to look after my husband. There is this work pending, that work is pending. So they don't take out time for themselves, and the things reach a very late stage when things look really worse. That is the time to come and seek help. So in those cases, the results obviously are not very good. So the earlier we catch cancer, the better we can help patients and we can save more lives. So it's very important to tell the women that they have to take care of themselves. They're the backbone and strength of the family. So it's important that do not ignore your health. The earlier you come to us, don't be scared. You should discuss whatever problems are there with your doctors. We are here to help you. The world has advanced. We have incredible treatment options, and when you seek help, you really get help. So it's very important from the patient experiences we have learned that it's very important to take care of ourselves, and saves the family also going through a difficult turmoil. Having a cancer patient in the family is not easy just for the patient but for everyone. So it puts things up and down for everyone. So it's important that health should be the priority.
Thank you, Doctor, for very kind words. Dr. Virushka, what most importantly, I forget to ask one very important question. If anybody wants to go for genetic testing, what is the easy way to proceed?
So we do have it. It's most of the genetic tests are blood tests. We just have to find out which cancer we are trying to track and which is the most important one that we have in their family history. But it's available with us with Prime, where we do genetic testing for a lot of panel of genomes, not only for breast, for ovary, for thyroid. Everything's available with us. So anytime that they would like to do it, they can book an appointment. Dr. Arun, me, Dr. Gemini, we're all available at any point, yeah, to do it.
Thank you. And what are your golden words for patient to know?
Don't be in denial. Don't
Don't
be
be
in
in
denial.
denial.
As Germany rightly said, yeah, that women don't take care of their health much. And I think we all do the same. But please note, breast cancer is something which is very dear to all of us. We do take it very seriously. For a woman, it's really sad that when you are diagnosed with it, we can't do anything much besides give you the hope and get you through this life journey when it's very difficult. As Dr. Gemini rightly said, it's not a personal disease, it's a socio-economic, physical, mental trauma to the patient and the family. So please do get your checks. We're all available. Screenings, any questions, we're always there to answer. And especially examination by the right doctor, very important. As Dr. Gemini said, if you diagnose it, it has to be referred to the right person. They help us to filter the women to come to us. Yeah, so we appreciate that. Thank you so much. Yeah.
Thank you. Dr. Arun, any important thing you would like to tell our patients today? Tell our audience also today.
So, in summary, I can say that breast cancer disease has become now a preventable disease. Preventable in terms of, as we discussed, that we can detect it in very early or pre-malignant stages, and it can be also preventable in a high-risk genetic mutation, as I already explained previously. It is a very much curable disease if it is detected in very early stages. Stage 1, 2, 3 are considered to be highly curable stages. The stage means the cure chances increase up to 90% in certain type of breast cancers. And in advanced stages also it is easily treatable disease. Lots of options of treatment are there which can control the situation for many years for many ladies with this disease. So it is a preventable, curable, and treatable disease. We should not
Thank
ignore
you,
it.
doctor. Thank you very much. Thank you, all speakers. What I have learned, I would like to summarize from this program today. First of all, prevention is the key, and knowledge is equally important. So, you please seek information from your primary physician or the doctors you trust. Don't Google information, and whenever it comes to any kind of lump, not only breast lump, any kind of lump needs an examination by the appropriate doctor after your general practitioners, after your general physicians, or after your gynecologist. Surgeon is the doctor who will actually tell you what is the nature of the lump and or the mass anywhere in the body, let it be lipoma, fat lump, or anything. All lumps needs to be checked because we don't know how malignant it is, how cancerous it is. So it is very important. It is your life. You all need to be taken well care of this. What I also learned today is that if you are visiting your doctor and or you are generally doing any kind of breast screening or any kind of screening, if you find any abnormality or if you find any lump on the ultrasound, do have one consultation with the surgeon, because they're the right doctors who will take care of it. What I also learned today is that there's something called genetic testing. It's mostly in the blood collection format, and you can be free from any kind of worries or anxiety in your mind. And most importantly, breast cancer can happen to anyone who have breast issues. It can happen to children, it can happen to men, it can happen to women. Any kind of new signs and symptoms in your body, do not delay to reach to the right doctor. We are always there for you. We had today Dr. Virushka from Prime Hospital, Dr. Arun, oncologist from Prime Hospital, and Dr. Gemini, she has joined us from Prime Medical Center, Al Nahda, Sharjah. Thank you for having us today. It was a wonderful session. See you in our next webinar soon, inshallah. Thank you so much. Have a nice day.
Thank you.
Thank you so much.